Welcome to Senior Circuit. I'm Ashley Speliotis, the Director of the Council on Aging here in Somerville. And today we're joined with the Office of Emergency Management with Bill and Lauren. Thank you so much for joining us in September. Emergency Management Preparedness Month. I hope I got that right, so we can celebrate the whole month through. But why don't you introduce yourselves and share a little bit about emergency management and specifically the office here in Somerville.
So why don't you go ahead and go first?
Sure. Good afternoon. My name is Lauren Mahoney, and I am the Deputy Director of Emergency Management here in Somerville. I have been here since the start of the year in January, so just about 9 months now, and it's been great. Very busy, a very busy city. And I'll turn it over to Bill.
Awesome. So thank you. I'm William Fisher, but I go by Bill. I'm the Director of Emergency Management. I've been here for just over a year. Prior to that, along with Lauren, we worked for the Massachusetts Emergency Management Agency as local coordinators. So that position was what really started getting us into emergency management. In that position, we were given 30 cities and towns, and we went around and we helped them with their emergency management programs. And so doing that was great. It was a great position, but I kind of got hungry to start my own type of environment and build my own program. And this opened up in Somerville, and I actually had a colleague that said, you know, I'm familiar with Somerville. This is open. You really should go for it. And I applied and haven't looked back.
That's right. Still new enough to say welcome to the city, and new enough. Well, Somerville's had emergency management. The department is also relatively new and growing with you. Is that right?
Yeah, it's true. So there was a director previous, was here about a year, and then previous to that, the Office of Emergency Management fell as an additional duty under the fire chief, or he would divvy the duty out to somebody else, but it fell under the fire department as an additional duty. So having a standalone department for emergency management is relatively new to the city of Somerville. I think it's great that the mayor had this initiative and the foresight to put this forward, because for a city as complex and the size of Somerville, it really needs its own department to do these emergency management functions.
Sure, because I think we all hear about like the police department and the fire department, like you mentioned, but the emergency management department, what would fall under your department?
So it's funny because the way I answer that question is we're more of a collaborative body. So if you want to think about, the best analogy I think is you probably have grandchildren or children or relatives that have children, and you've probably gone to like a 5-year-old soccer game. They have a lot of fun out there, but it's kind of chaotic. They all just kind of chase the ball around. And so where we come into play is when you think about as they move through the different grades and they move up to high school soccer, things are a lot more planned out. It's the same people, the same game, but somebody is coordinating what everyone's doing. So they've gone through a sequence of they've learned the game, they've been given instruction, maybe they've done some exercises or practice to learn their different positions and how they all work together. And that's where emergency management comes in. We have all these different functions. I say to departments, you are not expected to do anything else you wouldn't do normally. But we just want to take those skills and knowledge and expertise and bring them to an emergency. You do the same thing in a coordinated fashion. And emergency management is really that coordinating body that takes all those things that people do already and brings them together in an organized fashion.
And a little bit, it sounds like, of preparedness. So like before a disaster strikes and maybe coordination after disaster happens. Would that be fair to say?
Absolutely, absolutely. So when we think about emergency management, we think about preparedness. So you think about mitigation. It's a cycle that we follow with this: preparedness, response, recovery, planning. So the way I look at that is because it's a cycle, you can decide what on-ramp you want to take onto that, that mitigation, planning, response, recovery. Or life can decide what on-ramp you're going to take. You'd like to take it somewhere around the mitigation or planning phase, but sometimes it does the response, and you just kind of have to adapt and move through. But we choose to have that planning and that mitigation and that preparedness stance so that people are as resilient as they can. The city's resilient, the businesses are resilient, and again, the people are resilient.
Sure.
And we do that through a lot of different programs that hopefully we talk about today to make sure people are prepared.
Yeah. I mean, let's talk about preparedness then. What types of programs do you offer? And I think maybe a little bit later we can talk about how we can prepare for ourselves in our own homes.
Yeah, absolutely.
So preparedness definitely starts at the individual level. As Bill mentioned, you want to make sure that you are prepared first as an individual, kind of thinking about, you know, if you've ever traveled on an airplane, they always tell you, you know, if the oxygen masks drop down, make sure you secure yours before helping others. You can't help others until you help yourself first. So if you can make sure that you're prepared, then you make sure that your family, loved ones are prepared, people in your household, then, you know, it goes out to your neighbors, your community, you know, then the city at large.
Sure.
So making sure that you start with yourself and then building out that circle is definitely the best approach to take.
Do you think it would be the same for every emergency, would you advise people? Or like you're saying disaster strikes when we least expect it, right? And we don't perhaps know what disaster or emergency would happen, but what's some general ways that people can prepare for an emergency?
So there are two things you can do. Is first, you can have an emergency kit prepared, and a good example for having an emergency kit would be if you're at home and you know that you're gonna not have power for a couple of days, so a prolonged power outage. And another example would be having an emergency go bag. And an example of that would be if you had to leave your home for an extended period of time due to unforeseen circumstances, right? And things that you could put in that bag that could kind of get you through, we typically say, the first 72 hours after an emergency or disaster. And reasons that you may have to leave your home, you know, one of the most common ones is, you know, if you have an unfortunate fire, a residential fire of some sort.
Sure. What types of items would you recommend? Like, is it 72 hours or 3 days? Could be a lengthy amount of time. And, you know, I'm picturing, like, how big would your go bag be? What would be in it?
Right. It's a personal choice for a lot of the different items, but you think of things that you would need. If you think of like somebody going to the hospital, you always have all had loved ones that went to the hospital, and maybe you visit or you call and you say, you know, what can I do to help? And they're like, hey, can you go to my house and you can grab these things? Typically it's a similar list. And so we're looking at things like extra clothing, maybe extra shoes and socks. We're looking at chargers or charging cables, that sort of thing, flashlights, information, so having a list of your medications, maybe a list of contacts for your doctor, your relatives, important documentation like passport, licenses, that sort of thing, so that you have all the different things you need. But it's kind of a living kit. You know, you're going to look at it and think, okay, I have these things and I want to add to it, or maybe something happens and you're like, next time I want to do something better, which fits an emergency management type stance where we try to look at, we plan for things, and then when we do them, either through an exercise or a real life event, we always do an after action review. And the reason for that is we have that valuable data, so we want to capture that data and then make sure that the next time we're utilizing that information to make those improvements for what went well and what could be improved upon. So the next time we do it better. This is the same thing. So if you have something where maybe you have a plan at home or the kit and you have a situation happen at home, we definitely encourage you to reflect on it and say, okay, what worked in our plan, or what worked for the items we had in our kit, or some things we might need, or things that didn't work in your plan, and then use that information to integrate it into updating the plan.
Exactly. I think when you mentioned list of medications, you know, maybe the medication itself, but the list, but I'm also thinking like phone numbers and our reliance on cell phone now, and not knowing people's phone numbers, to have different numbers and data written down for you.
I would also just like to add to Bill's great list is, you know, having maybe different spare batteries in your go bag or emergency kits, especially for those items like flashlights, or, you know, even a radio, so that you can get emergency messages if necessary. And I have to put my plug in as well that if you're a pet owner, we also have to make sure that our furry family members are taken care of. So make sure that you have their documentation as well, whether it's a copy of their rabies vaccination or you know, paperwork from their veterinarian. Make sure that you have a spare bowl for them in your kit, a leash, a collar, just, you know, some things, because you want to make sure that they're comfortable too, because it can be stressful for them.
Yeah. You mentioned the radio, which is a great way to stay informed once an emergency happens, but are there different city alerts that people can sign up for to be prepared ahead of time, or well, you get the message that a emergency is happening?
Absolutely. So you said it. The best way is to make sure that you are signed up for the Somerville City Alerts, and you can make sure that you're signed up for those by either going on the city website or contacting 311, and they can either help you sign up or ensure that you're signed up for them. You can also get broader alerts, you know, for the state of Massachusetts and beyond through wireless emergency alerts or WIAs. And those are sent out at the state level. And by having those turned on in your cell phone settings, it's that sound that comes across our cell phones that kind of, you know, makes your heart stop for a minute, that wah, wah, wah noise. And you can make sure that you're getting important alerts that way as well.
In the city of Somerville alerts is the alerts, but also it's valuable information. Maybe there's events going on, maybe it's road closures, whatever. So we always encourage people to sign up because you're going to get valuable information. The other really cool thing about that Somerville does better than the state and the federal government, nobody but plug, is that we will send the alerts out in 7 different languages, and that's thanks to the great department over the Immigrant Affairs, the Immigrant Affairs Office. They're amazing, and they take all of this messaging and they translate it for us so that when it goes out, we're reaching people in a language that they speak, and that's important because we want the message to, number one, get to them and be something that they can act upon because they understand the message. But also, I mean, it's for me, it's important that people understand that we respect their culture and their language, and that we're coming to them in the language that they speak. I think that's a very important piece, and I think that helps people trust and heed the information we're trying to give them in that situation. It's another important point. It has to do with the alerts, but it's a different type of alert. If somebody is having a medical condition where they have durable medical equipment at home, that depends on power or any other utilities, you can register with Eversource. And so, and we can assist you. You can reach out to the Office of Emergency Management through email at oem@somervillema.gov, or you can reach out on our website. We have different contact information there. But basically, when you get on that list, now Eversource knows as they're trying to do restorations, they can prioritize certain restorations, and they'll even go so far as to check in on people to make sure they're okay. Now, having said that, if you find yourself in an emergency, and you have a need for some sort of a medical equipment that is needed to sustain your medical health, you should always call 911. If for some reason there's a disruption that you can't sustain because of backups or that sort of thing, we'd encourage you to call 911.
Yeah, that's great to know, because I know there's lots of medical equipment out there that requires power, and not knowing or not receiving alerts of when power is going to get restored, or hearing on the news that it could take days, can be very intimidating for people. We talked a little bit about our things we could do personally to get ourselves prepared, and signing up for city alerts, having the go bags, but I know you do a lot of education as well. Would you like to share a little bit about that, or what's available to residents or city staff, or both?
Yeah, absolutely. So we love presenting. It's a big piece of the resiliency. We talk about that 72 hours, preparing people, teaching them the skills they need to be able to you know, come to the emergencies and be the most resilient is probably the most important piece. And I also think that there's a piece where I want to have that relationship. I want to interact with all the people that make up the city of Somerville, so they know me. They know me by a first name basis, they know me comfortably, and so when they need something, they're comfortable reaching out, and we have that relationship. Also, as we're building plans and ways to deal with emergencies, I need to know where everyone is coming from to the emergency, because there's so many different aspects out there. And so one of the things we're looking to do over the next fiscal year is to partner with the community, because we believe in a whole community approach, that sort of thing. But we look at it as, when we prepare for emergencies, we look at it as understanding what the emergency is. So there's you can look it up on the website, there's a hazard mitigation plan that we did about in 2022. It's updated every 5 years or so, and that looks at the last 100 years of disasters that happen. And so you can decide how you're going to plan for the emergencies moving forward using that information. And we use that information moving forward. And if you want to add something to that.
Yeah, and just, we try to get out in the community as much as we can. As Bill said, he's been here about a year, and myself just over 9 months. So we're getting ourselves out there. We were at the Slice of Somerville event, just talking to residents of Somerville. We are attending the community meetings, and we have our website, as Bill mentioned, somervillema.gov/OEM.
And coming to the Council on Aging
to
do presentations a little bit like this one, sharing information, but going into a little bit more depth of what can go in your go bag and how to be self-prepared, so people can look out for more of those initiatives to come, more education. As you shared with me before, every month is emergency preparedness, right? But some months more than others, right?
Some months are specific.
Exactly. We think of September emergency management. Soon coming up, hurricane season.
We're in hurricane season. Right now, matter of fact, there's a tropical storm that just formed, but it's going to stay way away from us.
That's right.
But the training you're talking about, that's called Until Help Arrives, and that's a great training. We love presenting that because it fits an unbelievable niche. It's nothing crazy. It's not a huge amount of information, but it hits the, when something happens, an emergency, what do you do until that first police car or ambulance arrives? And so it's a fun training. It's very empowering. People leave feeling like, I want to know more, but I feel so much more empowered and ready to handle an emergency. So that's one of the trainings. The other training that we're starting soon, that we're going to be modeling on the staff first, but we're going to be trying to get out the community, is something called CRAZE, and it's Civilian Response to Active Shooter Events. Unfortunately, in this day and age, it's a training that's necessary, but it's a very simple training. It's got very simple concepts that teach people, if they find themselves, God forbid, in an active shooter situation, the tools they can use and the opportunities they have to have the safest resolution from there.
You mentioned simple things that people can do, and I think back to childhood and schools, and they start off with simple things, and Until Help Arrives has a lot of those as well, to help you feel in control in the midst of a crisis. And thinking about things like, what's your evacuation plan? And how do you get out of your home in case of a fire? Who do you call? So sometimes I know even the smallest actions that you can take can help center yourself in the face of a crisis.
People typically enter and leave the same way every day, from work and home, or their homes I know a little bit better, but if they go somewhere or whatever, they typically enter and leave in the same way.
And take the same route getting
Take the
there.
same route, exactly. And so if there's something that happens where there's a blockage, maybe it's on fire or something's happening, they don't know where the other exit is. So we always encourage people to look for that second exit whenever they go anywhere. One day, take a different exit out of the building, find the emergency exits. As well as, one of the things our department did was we went through and we mapped all the city buildings so that now there's evacuation exit route maps in every room and every city building over the last year.
That's great. We talked a lot about preparedness, but you mentioned before there's a whole cycle. And what happens and what role does your department take if a disaster were to occur?
So, as Bill mentioned, we're the collaborative body. So I could best relate this to some events that have happened in Somerville most recently. We had 4 pretty impactful fires, and they were all the same but different. So the similarity was that they were overnight or late night fires, but they were all different in where people came into the disaster, like we
Sure.
mentioned before. So meeting them where they were at, understanding their needs, and helping them get back to that point where, you know, they can start to move on. So in 53 days, there were 4 significant fires in the city of Somerville over a 5-week span, so between July and the end of August, and it left just shy of 60 people displaced or housing insecure. So with our collaboration and working with multiple city departments, outside agency partners from within the city, within the state, we were able to assist all 58 residents with their, you know, needs and assistance and bring everything to the table for them.
Yeah.
Yeah, and so, you know, a lot of the things we did was, you know, we were able to bring services to the people. So one of the first fires was at Wheatland Ave, and those residents needed a lot more assistance. And so when we worked for the state, we would do something called a Regional Recovery Resource Center. This didn't happen to meet the criteria for the state to do that. It was just under the numbers. But Lauren and I, you know, consulted, looked at each other and said, we used to do this for the state, but we can do it here. So we held a local recovery resource center. We held it in one of the schools. We invited the people to come, because when you're in an emergency, it's very difficult. When you're not in an emergency, it's very difficult to navigate all these processes. You know, you take the RMV alone, if you got to replace your license, it's a nightmare. So now imagine that you're going through a crisis and you're trying to rebuild your life. And so what we like to do is we like to bring all those resources to one place and then have the person come there. And it's a great mechanism, because the person arrives and we have Red Cross volunteers that work as ambassadors. And so they'll partner up with them and they will literally escort them table to table to table. And each table is a different organization or department that has resources. Talking about that RMV example, the RMV agreed that anyone that lost their license or ID from the RMV, all we had to do as emergency management was take the information down, send it in a spreadsheet, and they would mail them a license free of charge.
Amazing.
Like, took the whole process out.
You don't have to go to the RMV, try and make an appointment, you know, have the documentation to prove it. It can be such a hassle, you know, like Bill said, even just day to day. And then the added stress of, you know,
going
losing your
there
home
and you know, I would imagine not having access to the documentation needed, and how do you get through those barriers?
Right, is a lot. And so we also had pet supplies there through animal control, trying to get insurance or other different benefits. You have to prove that you were part of the fire, so we had the fire department there giving out copies of the fire report. We had Zuchi.
They're a Buddhist nonprofit organization, and they give monetary resources back to the impacted residents. And they also give great hugs. They really do.
So when we used to do this for the state, their table was always a bottleneck. People never made it past their table because they would stay there and hug and cry. They're just amazing people. They should be at every one of these things. I can't say enough about them.
Also, as Bill mentioned, the Red Cross there acting as ambassadors. We also had the Salvation Army there. They provided a meal for the displaced residents, as well as all the services, you know, that they offer, vouchers for their thrift stores. We had Mima there, a representative from the Massachusetts Emergency Management Agency, the local coordinator that works specifically with the city of Somerville. We had Office of Housing Stability assisting people finding new housing. The police department came through just to, you know, check in on the residents. We had some counseling services there. And
there was
HHS
legal assistance from SOIA. There was also HHS.
The clinical health workers. So public schools, you know, because for children that are impacted, making sure that they have what they need going back to school. food pantry, food service, it's
A
so
little
much.
bit of everything.
So much.
Because like you said, everybody's needs are different,
Yes.
and your needs are different in the face of emergency. And so I think we caught the whole circle from preparedness to when disaster strikes. I want to thank you very much for coming and sharing information with our senior community, and we will see you at the Council on Aging for more training
So this is
soon.
just the beginning.
Just the beginning.
Just the beginning.
That's right. Well,
Thank you for
being
having
here.
us.
Of
Thank you.
course. Thank you.